Amanda here. Hi, good afternoon. Today I'm studying again for pediatrics, and this time we're doing cardiac. And specifically with this video, I'm doing the fetal circulation. And I have a little board here that I use to study. I'm just gonna show it to you. It's a little embarrassing because I'm not an artist, and so it really is bad. So please forgive me, but it helps me to learn if I can write it out and map it out myself. Um, so we all know with the adult circulation what happens. We know that blood, oxygenated blood, or deoxygenated blood actually, is flows through the superior and an inferior cava, and it goes vena cava, and it goes to the right atrium of the heart through the right ventricle of the heart, where it's pumped into the pulmonary artery that goes to both lungs, right, where it's reoxygenated. Gas exchange happens at the alveoli, and it's taken back to the heart, specifically the right atria of the heart, through the right ventricle, and is pumped to the aorta, where that oxygenated blood is then taken to the rest of the body and the tissues. Right? That is normal adult circulation and how that works. With fetuses, it's a little bit different because again, they're living in an environment that's all fluid. They're in that amniotic sac. They're not breathing air, so their lungs are filled with fluid. And so gas exchange does not occur like it does in you and I. So they have 5 adaptations that occurs in your utero that allows them to thrive and survive until they're born and they take that first breath, right? So the right here I have a little diagram, which is terrible, but bear with me. This little square box represents a placenta. And the first adaptation that fetuses have is something called an umbilical vein. And that vein actually is opposite of the veins in our body. It's taking oxygenated blood from the placenta to the fetus. So that's the very first adaptation. The second adaptation that fetuses have is something called the Ductus Venosus, and it's basically a shortcut from that umbilical vein into the inferior vena cava. So it allows that oxygenated blood to flow from the umbilical vein through the ductus venosus and dumps into the inferior vena cava. Now, as we know, the inferior vena cava goes into the right atrium of the heart. Now, the flow of blood is still normal. It will go into the right ventricle, but there is a third adaptation that fetuses have. It's called a foramen ovale, and it's basically a hole between the right atrium and the left atrium, right? So between those atria, and it allows the blood to flow from right atria directly into the left atria, right? So some of that oxygenated blood is going to go directly in there. Some is going to go into the right ventricle and pumped into the pulmonary artery. Now, remember we said that the lungs are filled with fluid, so there's high pressure in those lungs, right? There's not a lot of blood that's going to the lungs because of such high pressure that's there. The fourth adaptation that fetuses have is another important one called the Ductus Venosus, and it's basically a duct between the aorta and the pulmonary artery, and that allows the oxygenated blood actually, to flow directly into the aorta, because remember, fluid usually flows from a high pressure area to a low pressure area. So if you have this lungs that's filled with fluid, right, there's going to be a lot of pressure in the pulmonary artery, so that blood that's in there is going to dump directly into the aorta through that ductus venosa. So it allows oxygenated blood, as well as the foramen ovale allows oxygenated blood to go to the body, even though there's no gas exchange that's occurring at the lungs. And blood will flow normally through the body. And then the fifth adaptation that fetuses have is something called umbilical arteries. They have 2 of them that will take the deoxygenated blood, back to the placenta. And then the whole cycle repeats itself constantly throughout the 9 months or 40 weeks, or while the baby is in utero. So it's pretty interesting. And in our next video, we're going to talk about congenital anomalies that occur post-birth. So a lot of times what happens when the fetus is born, it takes that first breath, certain things happen that, like the foramen ovale should be closed, the Ductus Venosus and Ductus Arteriosus are going to close, and sometimes some of those things don't close, and then we have problems that occur, or problems that arise. So we're going to go into the congenital heart defects in our next videos. And that's it. And again, I'm so sorry for this mess. I have to do better.